Let's talk about cataracts and cataract surgery. A cataract is a clouding of the lens in the inside of the eye. When we're born, our lens is crystal clear and all the light makes it through, providing a clear image. Over time, most people will develop cataracts. Cataracts are a clouding of the natural lens inside the eye. Symptoms of cataracts include general loss of clarity, glare around lights, trouble driving at night, trouble seeing in dim lighting, and other things along these lines. Once these symptoms reach a point that they're interfering with someone's life, then cataract surgery is warranted. Cataract surgery is a minor outpatient procedure. In fact, it's the most common surgical procedure in the United States and much of the world. Cataract surgery is done at our outpatient surgical center about a mile from our office. During surgery, patients are under a twilight-like anesthesia. They won't really remember too much of what's happening. The surgeon will enter the eye, remove the cataract, place in a clear lens, and that's it. Patients will return to the office the next day. The vision will generally be cloudy. On average, we do recommend most patients take 3 to 5 days of downtime after surgery before they can resume most normal activities. Eye drops are needed 1 week prior to surgery and generally for 4 weeks after surgery. Sometimes the use of eye drops may need to be extended beyond 4 weeks depending on how the eye is healing. And also, if patients do have other health conditions, the healing may be delayed longer than the traditional 3 to 5 days, and we would discuss that with you. We then generally perform the second eye should patients need surgery in both eyes, and then follow up at about 2 weeks and about 2 months after surgery approximately to ensure everything is healing appropriately. Now, we do offer some different treatment options here for the cataracts. We do offer a laser-assisted cataract surgery. The laser is used to remove the cataract in the most precise manner, which also promotes the fastest healing period. The way that it goes about this is less energy is needed inside the eye, so the eye generally heals faster, making the surgery safer and more precise. The traditional method of performing the cataract surgery, all the incisions are made by hand. We also offer different lens choices. There's a standard lens which is covered by insurance called a monofocal. Monofocal has a uniform focus to it, generally designed to reduce distant prescription. However, it does not correct for two important things, which would be astigmatism or presbyopia, or the loss of near focus. So patients after having the monofocal generally have to wear glasses for both far and close, usually in the form of a bifocal type lens. Some patients do qualify for advanced lenses that can help correct the vision to different degrees. One of the lenses that we can use after cataract surgery we refer to as the Forever Young lens. The specific type of lens is called a multifocal, or even more specifically, a trifocal. The trifocal lens is designed to correct vision at multiple distances, in particular achieving a good level of far vision for things like driving, watching television, watching movies. Intermediate vision, things like seeing your computer screen, seeing a dashboard of a car, things like that. And close vision, things like looking at the cell phone, looking at a newspaper, looking at price tags. So the lens has a dynamic range to it, allowing for the vision without glasses at those three distances. There are many benefits of the lens, but there are some limitations to it. For very small print, such as very small print on a medication label, it is expected that reading glasses will still be needed after surgery. So while patients generally don't need to carry a pair of glasses around with them, they will need to have a pair of reading glasses that they have for these small activities. Also, bright light is necessary to allow the lenses to perform best for reading vision activities. So patients will always see best when they use bright light for reading. One of the downsides of multifocal lenses is the way they work is by having rings in them. These rings split the light, allowing you to see the vision at multiple distances. However, they do create some rings or halos in your vision. These are mostly at night, such as around oncoming headlights. Most patients have them to a moderate to even a pronounced level for 1 to 3 months after surgery. They then usually go to a much lower level over time. Some patients have a full resolution, but the majority of patients do have permanent but mild glare and halo around lights. So the good thing about the multifocal is that it does allow a full range of vision correction at multiple distances. The downsides are that reading glasses will still be necessary for small print and for low light. Extra light is necessary in low light situations, and then halos and rings around lights are a permanent, though mild for most patients, side effect of the lenses. Overall, though, the vast majority of patients who do have vision correction with a multifocal lens are very pleased with the results after the body has had time to adjust to the lens implant. Cataract surgery is overwhelmingly safe. Like we discussed, it's the most common surgical procedure in the United States. Just like any surgery, there are some side effects. The number one is dry eye. Dry eye does tend to occur for 3 to 6 months after surgery. Using some eye drops will help to reduce that. We also offer some preventative treatment options to help improve the dry eye after surgery. We call this the ocular surface package. It's a 2-step process. Step 1 is where an instrument is used to gently clean the eyelids and eyelashes. This removes any excess bacteria that can build up here. This has 2 purposes. It helps the eyes produce naturally healthier tears over time. It also reduces the bacteria buildup that can be occurring, and in fact, everyone has bacteria there to different levels. This bacteria does have a small chance of entering the eye in an open eye surgery like cataract surgery, which could contribute to an infection. So by doing this gentle cleaning prior to surgery, it helps promote less dry eye, and then it improves the safety of surgery. The second step of this ocular surface cleaning or ocular surface package is a warming and massage of the glands in the eyelid. These glands are called the meibomian glands, and they help the eyes produce oil that helps keep the tears healthy. This procedure is gentle, safe, taking about 15 minutes in the office, and the results of this have been shown to last for several years, helping the eyes produce healthier tears over time. The second side effect of cataract surgery, like we already discussed, is blurred vision in the recovery period. Everyone heals differently, so it's very hard to predict exactly how you will heal. You may experience blurred vision for 3 to 5 days after surgery. Some patients are able to resume activities sooner than that, and some patients may have a more prolonged healing process, particularly if there's any condition that predisposes you to that. Multiple steps may be necessary to get the very best results after surgery. Step 1 is we implant the lens. Everyone needs a lens implant. Step 2, the lens that we put in is crystal clear. Over time, it can develop a clouding or film to it. This is called PCO, or posterior capsular opacification. A minor in-office laser procedure may be necessary to clean the lens. This has to be done at least 3 months after the surgery, but could be needed months to even years after surgery. It's quick, it's easy, it's painless, it's done in the office here, but about 1 in 2 or even more, 50% or more patients will need this. Finally, for those looking for vision correction without the need of glasses or contact lenses, some of these advanced lenses are able to do this. However, we can't predict exactly how the lens will settle and heal in the eye. The lens may settle slightly forward or backward from where it's intended. If this does occur, the patient may heal with some prescription. This can be adjusted for after by an additional corrective surgery like LASIK or sometimes a sister procedure called PRK. We would need to let the lens settle for at least 3 months, and then we can perform this after if it's necessary. There are some risks of entering the eye that are uncommon, including a risk of infection inside the eye. This is called endophthalmitis, or a retina problem called a retina detachment. Either of these, should they occur, are treatable conditions. Treatment is generally very effective. The occurrence rate is generally less than 1 in 500, and most patients who have an occurrence, which is very rare, do make a full recovery. Unfortunately, some patients could lose some degree of vision in the affected eye. But in summary, a cataract is the clouding of the lens inside the eye, causing vision difficulty. Once patients are having a degree of vision difficulty that's interfering with their daily life, then cataract surgery and a lens implant can be used. Patients can choose to wear glasses or contacts after surgery, or some patients qualify for advanced lenses that can help correct the vision. It may be a multiple step process, including the implantation of the lens, a laser to clean the lens, additional corrective surgery like LASIK, and finally the brain takes some time to adjust to the vision through the new lenses.